This morning I've been co-chairing the first lymphoma special interest group for BSH, which covered a wide range of areas of lymphoma. And first off we had Matthew Ahern from Leicester, who was demystifying T-cell classification, which was a fantastic overview of the changes in the WHO criteria for T-cell classification, which is quite often does need demystifying because it changes quite significantly. And I think he clearly explained how if we get the classification right, it can help us improve the prognosis for patients with difficult disease. And then the next session was Jessica Okasan, who has a fellowship into the research of the genetics in follicular lymphoma. And again, this was a fantastic overview in her work, allowing us to gain more knowledge about targets for treatment for patients with follicular lymphoma. And then the final session was a how I treat session about how I treat asymptomatic follicular lymphoma. And Professor Guillemini did a fantastic job on reviewing the evidence for the benefit of when we should treat patients with follicular lymphoma. And this was particularly relevant, I feel, to a UK audience who now have the ability, following recent NICE guidance, to use rituximab for patients with advanced stage yet asymptomatic follicular lymphoma. And I think he had an excellent discussion about the pros and cons of this approach, and really why for him standard is still a watch and wait approach and not to use treatment for asymptomatic patients. But there was good stimulated discussion in the audience about the health economic benefit and as to why that decision was made by NICE in the UK, about the use of rituximab earlier than we would at present. So the session was well attended, it stimulated good questions and debate, and I think it was well received. The areas that stood out the most was just clearly illustrating that people do very different things in terms of management of follicular lymphoma, and I think that the clinical difference in management was interesting. And in Italy, there is often a different approach to how we manage patients in the UK. I thought it was interesting that they use a lot more rituximab single agent for patients with symptomatic disease, and at present we don't have funding in the NHS for that approach. That's maybe something that will change in the future. And then I think that it was excellent to have Matthew and Jessica's work delivered so eloquently and clearly, with a very clinical approach as well, so that it's not only helpful for people in the lab but also clinicians. So it was a really excellent session.